and to help you to do the imaging rather having fear.
Okay.
So can you start?
Yeah. Shall I?
Yeah, you could.
Good evening.
Good evening.
I'm incident working as a registered nurse in this department, and today I'm your assigned staff. So, how are you feeling today?
Good evening, nurse. My name is Sarah, and I hope you might be knowing I'm 36 years old, but I'm literally afraid to go for this MRI scan because doctor told that he is suspecting, that I might have some kind of, brain issues like, brain tumor or some other problem. And I was told by the doctor that MRI is mandatory. So the radiographer is trying to, convince me in order to go for this MRI, but I'm literally afraid because I'm scary. The reason why I'm afraid, I tell you that I'm claustrophobic. If I even if I go in travel in lift, I'm really afraid. I never travel alone. So that is my fear. So how could I manage? How could I, tolerate myself? Can you, give me some tips? How could I cooperate for this MRI scan?
Okay, Sarah, I can understand your concern. As you're claustrophobic, it's a real. It's a normal tendency. Like we would be getting scared, and even MRI is like a like structure. But Sarah, you have to understand like the signs and symptoms which you are showing, and we have to diagnose it as soon as possible to start your treatment. Okay, Sarah.
Sure, I
So
do understand. I do understand, but as I told, I'm claustrophobic. How can I, come fearlessly for this, MRI scan? That's my concern.
okay, Zara. So why don't you try to divert your mind? Don't think like you are going in a closed room or something dark side or something which is making you very scary. Why don't you think about a pleasure moments or memories which make you which divert your mind from the fear which you had? Have you
Yeah,
ever tried in your life? I mean, when you have you scared that while going in the lift also, I mean, so you are scared to use the elevators and all.
exactly. I'm literally scared to use the lift or elevator alone. I never tried alone. And this
Okay.
MRI scan, mainly because I'm afraid because of it is quite noisy, right? And there's some kind of vibration I could experience, and the lights are daunting. It is some kind of I get nausea. I feel like some kind of weird sensation is going on once I'm sent inside this, mainly as I'm getting strapped to that, and this is something weird for me.
Okay, I can understand. So have you ever gone MRI previously?
No, I have not. I have not undergone this MRI previously, but I know
Okay.
what is this MRI. I was told by the radiographer how it could be done. That's the reason I'm afraid.
Okay, Sarah, don't worry about it. But see, because of the thing which has been occupied in your mind, because of that you are getting scared of it. There is no like vibration sort of sound. A machine would be going on to scan your image. I mean, to take the image of your brain to rule out what is wrong with there. And we are going to use the contrast. Like, as we go for a fantasy park or something, you can think in that way that you're going inside, you will be in a supine position, okay? So they will be you will be put inside a machine. They will be taking like we take a photograph. Okay, so they will be taking some photographs of your brain. In that, in between, some sound would be there, a scary noise, as you are saying. But you can divert your mind thinking that yeah, this noise is because of the machine working, or you can start thinking of your some imagination so that you can divert your mind then thinking reluctantly to the MRI and its that closeness, and because of the claustrophobic, all these effects are coming up. Are you getting it?
Yeah, I do understand what you try to convince Nurse Vinci, but as I'm claustrophobic, definitely, I would get the panic attack, when I'm done this MRI. If I get into the panic attack, what will happen during the MRI?
You don't have to worry about the panic attack. MRI is just a procedure of 2 to 3 minutes, not more than that. And there will be a lab technician to help you out. They will be continuously monitoring you. Okay? So if they feel like you're going to have a panic attack, they will be removing you as soon as possible. So you won't be kept inside the machine for a longer time. Are you getting, Sarah? So
Yeah, but however you say, no, so I'm really afraid because
yeah, I can
recently I have read a news because once I was told I should go for an MRI. I was gathering some information. There is a death because in the MRI machine for a 6-year-old boy because of some metal that has got attracted towards and that has broken his skull. And some patient has experienced burnt face by wearing the band. That is, so this kind of, fear I
okay,
have.
okay. Because of those incidents, it's preoccupied in your mind that some other incident can happen.
Exactly, exactly.
Okay, Sarah, don't worry about that. Our staffs are well trained. So when you are going for MRI, okay, all metallic items will be removed from your body, like chain, bracelet, whatever the metallic item you are wearing, okay, whatever it will be asked you to remove. We will be taking your consent before that. We will be explaining you what is the exact procedure, okay. And in MRI, burns doesn't happen. It's just a radiation, okay, a small electronic waves to be passed to just to take some few images as we have learned in your chemistry, gamma rays, alpha, beta, gamma. Okay, and that frequency is very less. It won't cause you harm. And our lab is well sufficient with the efficient staff, so they are not going to cause any error. Okay, because of this scary incident, you are getting more claustrophobic for the MRI diagnostic test. So, Sarah, it's better to remove those negative tests and think about the positive effect. Like once it has been diagnosed, soon your treatment would be started, and soon you will be discharged back to your home. And the signs and symptoms which you are facing now because of this illness would be not further once the treatment is started.
Well, no, sir, give me some time to think on it. And is there any other alternative instead of MRI? Why don't we go for CT? I think CT is better, right?
Actually, MRI is a higher version of CT scan. So in CT scan and MRI is almost same. Okay, there is a changes in the frequency. So even in CT scan, it's a closed area only, still a claustrophobic. But in MRI, the images which we want would be in detail. Okay, so in detail, your brain would be done to rule out what is the cause behind the final symptoms which you are facing now.
Oh, is that fine, nurse? I really appreciate your patience and in-depth knowledge explaining things to a person like me. Yes, but give me some time. Let me get back to you because some kind of relaxation is required for me.
Yeah, it's better you get relaxed, think positive, don't think negative. If you start thinking negative, and then your fear and anxiety will increase only. And I will arrange one lab technician to help you and guide you in proper way in detail about MRI, what is going to happen in the lab. Okay, so he will guide you. He will let you know everything in detail, like removal of ornaments. If you have, are you having any pacemaker or any other device implanted in your body? I don't think so. Do you?
No, no, nothing. So,
Nothing like that, right?
yeah.
So if any sort of such devices are implanted in our body, then we have a high risk. Okay, that
Okay.
time we have a second and third thought: do we need to have MRI? But artificially, if anything is been occupied, which we can remove, then we will remove it, and then only we will proceed with the further procedure.
Oh, that sounds good, Nafsansi. Yeah, I just give a chance to myself to experience this MRI, sure. But give me some time. I get back to you. Thank you.
Yeah, sure. So I will reschedule your appointment for the afternoon purpose. Before that, we will have small session with the radio department. So he will explain you everything in detail.
Yeah, that
Okay.
sounds good. That sounds good. Thank you so
So
much.
shall I leave?
Yes, you could. Thank you.
Yeah. Thank you. Take care.
Yeah, very well spoken, Vincy, because you have got the very good information about why the MRA. But what happened is, when I started to say in the beginning that I'm claustrophobic, I'm afraid to go for the MRI because, I would get the panic attack. Definitely, I would get a panic attack. I asked you
Mm.
the question that what happens if I get, the panic attack. So you have to say that, well, Sarah, I really appreciate that you have gathered some information about the MRI and with regard to the claustrophobic, you are asking questions. First of all,
Mm.
I request you don't think too much about it. Just like you close your eyes and experience and accept this MRI. Yes, of course, some people might, mostly people could be claustrophobic when they go for the MRI. Definitely, it is a common symptom for most of the people. But I think you're quite anxious. Yes, in case if you have panic attack, yes, you would experience increased heart rate and difficulty to breathe, and you might sweat, and some kind of distressing symptoms will be there. So immediately we would stop and we would get you back. So don't panic on that. But before that, we just counsel you. We make you ready to accept it without any panic attack. So that is our responsibility as of now. That's the reason I'm speaking to you, explaining it in detail. So there, if I get a panic attack, what will happen? I asked you, but you have to openly say that, because panic attack is there means the heartbeat, fluctuation will be there and difficulty to breathe. That point there you should have shared. Okay, and next to that, I just asked you one more thing that I'm really afraid because the sound as well as the light and the vibration that I get. That
Mm-hmm.
also you just asked, have you experienced it earlier? That's a good question. But for that, what you have to say, though you didn't experience, based on your knowledge you are speaking, yes, it is no good doubt. I could really appreciate, but I could recommend you to follow some kind of counseling. Mind counseling is most needed. For example, before the MRI or during, you can talk to the technician. The radiographer could be next to you, and if you want, you can listen to some music that could really help you to relax and keep so you can make someone stand next to you like your friend or family members, and in case if you feel opening eyes is difficult for you, you can wear the sleeping mask. So that also we could provide. Don't panic on it. But that mental counseling that is most needed, you have to practice that mindfulness before you go for this. As I told, you are claustrophobic. So that information, so what to do, what not to do, how to cope up with that explanation, that is, counseling is needed. So there, what you can do, in what way, and one more doubt I asked you that recently I have read that a boy has died because of some metal that is attracted towards the same machine, scan machine, and he was collapsed. No, his skull was broke. So you could say that yes, it is only one incident happened recently, but don't get panic. Too much of anxiousness that could lead to a lot of confusion, and definitely it is impossible for us to go for this MRI. And that was a mistake. Actually, any metal is there, yes, that could attract towards the machine. It is a good question. It is a good doubt that you have asked. But ours is no, it is a well investigated hospital we run over here. We don't have such kind of a mishap. And first of all, we will check with you, and you will also be advised to remove anything that is metal from your body. And to be on the safer side, have you is there any kind of implant or metal has been implanted in your body? That question there itself you could have asked. Okay, at last you brought it into. You're speaking very well, but then and there, when it is asked, so this metal got attracted to us, there itself you could use that point, that spontaneity that could really help you better. Okay, fantastically spoken. But the points, very well you have spoken. But what you have, the way you had spoken, then and there you didn't. But little later you have brought